Welcome to the expert forum on disaster-related statistics. We'll be discussing today on how we can actually enhance our health-related risk using climate change and DRR-related statistics, and how we can better integrate our officials from the statistics to provide in this area. I'm Bapon Fakhruddin, working as a technical director for disaster and climate change in Tonkin+Taylor, based in New Zealand. I'm also a co-chair for Co-Data Task Group for Fair Data for Disaster Risk Reduction and IRDR Data and Disaster Working Group. Well, looking at the climate change and health impact, you can see that has an enormous impact due to the climate change in our health. Obviously, if you look at the statistics, it's quite growing. Nearly 250,000 deaths per year has been projected due to climate change related impacts. Safe drinking water is a huge issue in the developing world and has been projected 500,000 children under age of 5 years could be dead. Production is decreasing due to the climate change impact, and it could impact millions. As well as there has been the cost of health related to climate change increase more than 2 to 4 billion per year by 2030. So what the statistics tells us about the trend tendency, if you look at the safe water aspect, obviously our safety is getting quite high, and then hygiene ratio is getting low. Climate-related epidemics is also quite increased tendency. You can also see the air quality and the death, which is also increasing. So on all aspects, it has a quite significant impact on the health sector. But how and why we can actually enhance the system? A systematic integration of climate and health data for the risk assessment is quite essential, so that we better understand what are the climate change related hazard and what are the hazard actually creating an exposure to our health sector or the risk element within the health sector, and then how vulnerable our sector is due to the climate change and disaster risk reduction risk, and how we actually create consequences and what would be our adaptation option on these things. It requires a quite integrated approach as well as interoperable approach, so that we can work quite closely. But even if you look at the fundamental gaps, especially on the data gaps on the climate change, disaster and health sector, obviously the first things came out is how the lack of data for standardizing in this three particular domain, and then why and how we are not able to actually integrate this data, or there is a lot of issues on the interoperability of health sector data versus climate change and DRR database. And then there is always an accessibility and issues. You can see on the right side of the diagram that each element of a systematic integrated disaster loss data framework, and you can see there are actually many elements where there are lack of accessibility and availability of data by different users, different partners, different stakeholders, and often actually we don't have able to share the data or work together to make sure that the data has been utilized and used for betterment in the sectoral risk assessment. Often our institution works as a silos, but even if we look at the health sector, itself sometimes quite complex, because if you're looking at the injured people, death, as well as other disease control, you'll see actually different departments are dealing with such information. And there are also other departments like police, insurance, and other agencies are also engaged, and they often actually doesn't share their database with each other. So the institutional silos need to be reduced and work together, and how actually we can build up the engagement and partnership is quite important. So with these things, I can just sum up my talk with the 5 recommendations today's talk. One is obviously I would like to see the standardization of loss data quantification, which could help us to identify the risk assessment as well as improve our risk information for the sector, especially for the health sector. We need to make sure that how our data is centralized and stored in a one warehouse so that we better able to analyze those data for our hazard exposure and vulnerability assessment, ensuring accessibility and availability of the data, not only the health data but also other baseline data and other disaster and climate change data to better understand health sector vulnerabilities, how we can actually engage climate scientists, disaster expertise, engineers, and health professionals to identify our future health risk. And finally, we need to look at a need-based solution and adaptation options for the health sector rather than a top-down or other aspects. So once we look at the health sector, we need to better understand what are the need by the health professional, what are the need by the people for the health sector, and how those kind of information could be repackaged and reissued so that that could be useful and usable by the health professionals. Thank you so much.